acknowledging the higher power in this great universe who look after us, acknowledging the traditional owners of this country, the Ngunnawal and the Ngabri people. We welcome you again today to the Lo'au University multimedia program called Storytelling. Today on the 13th of March here in Canberra, this wonderful afternoon, nice and sunny and warm, and we're into autumn. Leaves are everywhere. Of course, my special guest again for part 2 of storytelling is Luisa Maile Latukefu, a wonderful woman. A woman who will tell her story, and we all are aghast, I think, and surprised that such a beautiful life we are able to hear about. Anyway, without further ado, we will pick up Luisa's story from when she finished her nursing studies in Leeton, New South Wales, went to Tonga, had her wonderful 21st birthday, celebrations with all family, and then on your way back to Australia, Luisa. Is that where we pick up?
Certainly is. Thank you very much, Luciane, for welcoming me back for our storytelling session today. I think it's about finishing that little journey because, as you know, I am enjoying my retirement now.
Yes.
Have been for the last 5 years. So,
What a journey.
yeah, thank you for having me back. And yes.
So, Luisa, we pick up from your return to Sydney?
That's right. If you remember, Luciana, think back, like, I did my general nursing training. It was the hospital based because now they do everything at uni,
Of course.
university here. And so I came back to Sydney in 1970, saying my age now. To do my post-graduation sort of thing in a course in midwifery and obstetrics, And I did that in Sydney at the Royal Hospital for Women at Paddington. Were you old
Louisa,
enough
is
to
it
know
still
that?
there?
No, it's not. Yes, that's right.
But that's a very famous, well-known
It
hospital.
was then, it was a good training hospital for
Yes.
midwifery. So that was from 1970 to 1971.
Okay.
Yeah, we did that. And in those days, it was really necessary to do the midwifery and, obstetrics.
Yes.
Because I think it was all about maternal
Yes.
health, and family health
Yes.
in those days.
Which you followed through all the way through
that's
your
right.
career.
Yeah. So I graduated from my midwifery training. By then, I met this young man who sort of interrupted my little
We're getting
journey.
to exciting
That's
stuff
right.
now.
And he was Lesoni Latukefu. So and he lived here in Canberra in those days. Back in the, this was 70.
How on earth did you meet someone from Canberra when you were in Sydney, in the big city of Sydney?
One of my friends, nursing friends, was getting married in Canberra, and it so happened that it was Lesoni's older brother, David Latukefu.
Yes, of course.
So they got married in Yes.
Okay.
Yeah, because Helen, she's Australian, but her
Yes.
father was teaching at Yes High School. So that's where we met. I think I hadn't seen any of the many Tongans here except in Sydney.
Yes.
Yeah.
And the Latukefus had been here for a while then.
That's right. Yeah.
Hadn't
They were here back in the 50s
Goodness.
when they were just building the Lake Burley Griffin.
Oh my
Yeah.
goodness.
That's right.
Yes.
I go off track now, but less on it. Yeah, but it was before they
It's a
built
good going off track.
Yeah, it was before they built the National Library
Oh.
back in those days. So they had two
Yes.
bookshops that sort of supplied the schools with their books. So yeah, it was back
Goodness
then.
me, way
Yeah,
back then.
That's right.
Oh.
Yeah.
So just to go off the track a little bit, Luisa, with the Latukefus back in the 50s in Canberra.
Yeah, that's right. Yeah.
Goodness me, were there any other families then in Canberra?
Yes,
Common families, I mean.
yeah, there was one lady back then.
Okay.
It was Mele Kite.
Really?
Yes,
Oh,
she was the only because she was married to an
that's right.
Australian.
Oh, of
Yeah,
course.
yeah,
Oh, so she goes way back then
that's
too.
right. And also Eseta Pustua.
Fustua.
Yeah, she is a student at the
She was
Australian
studying.
National University. Yeah, she was studying,
right.
and her husband
Was she Fustua then or Fulivai?
Pustua.
She was
Yeah,
already Fustua
Pustua.
then.
So, because they still called him Ulu then, back
Yes,
in those
yeah.
days. Yeah,
So he wasn't
he was here too
Lord
with
Fustua
her.
then, or
Yeah,
not really Fustua.
no, that's right. Yeah.
His father was still
Yeah.
alive. Oh,
So I came
so
down
you
from
met?
Sydney.
Yes.
Yeah, came down from Sydney and worked at Queanbeyan, which is just at the border of Canberra.
Yes, yes.
Yeah. And they
We
were
all say Queanbeyan is just another suburb of Canberra.
Canberra. That's right. Yeah. I worked in the Queanbeyan District Hospital for just this is back in 71. 73, they built the Walden Valley Hospital. Yeah, so...
What a history. This is like a history lesson.
It is for Canberra.
Especially for Canberra.
Yeah, that's right. All the young
Oh.
ones, yeah.
So Woden Hospital was built then, and then you
And then,
transferred over?
yes, one of our doctors, his sister was the new director nursing at the hospital.
Oh,
So we got him, Dr. Gillespie, to...
Dr. Gillespie.
That's right.
That's a well-known name.
Yeah, there's another
Yes.
Dr. Gillespie here,
Yes,
his
yes.
son.
Oh.
Yeah, so we asked him to transfer us, so we all transferred to the Walden Valley Hospital.
Brand new hospital.
Brand new hospital, open up the wards, and it was the first, they had their first intake of nurses then, in those days.
Goodness
Actually,
me, Luisa.
I was the only different person there with a
You were the
colour.
only special one.
That's right. I got all the attention.
Of
Yeah.
course. Oh, how nice. How nice to get that sort of attention because you were different and special.
One of the patients said to me, "So are you from the diplomatic corps?"
Or,
And I said, "No, I'm one of the staff." So
because then I
in those
guess,
days,
yeah, the only people from different backgrounds, and you look quite special anyway. They must have
Thank you,
thought, oh, she must be a
Luciana.
diplomatic's wife or
Yeah.
something. Ah,
Yes,
goodness me. And this is 73.
73. Yeah, they only had one ward in the whole hospital. So
Which is, what sort of ward was it?
that was the medical ward.
Oh, okay.
Yeah.
All right.
So
right.
when I came there, we opened up the surgical ward, which was the second ward in
They
the
opened.
hospital. Yeah.
Goodness me.
So
Not only do you, I'm just thinking of some of these really important, times and places in history that you were involved in.
that's right.
Yes.
Come to think of it, there's been a lot of changes.
Huge,
Yes.
Luisa.
Both in my professional journey with nursing, there's a lot of changes. And also like now they cut it down and then they started putting it to the universities.
When did that start, Luisa?
I think it was in the 70s or 80s.
Right,
also.
later,
Not very,
much
much
later, okay.
later. Yes.
And there's still talk from the old staff saying that they prefer nurses that were trained in the hospital other than university. They told them, they only know by the book. And of course it's unfair to say.
No, I always
very
like,
unfair to say,
That's
but
right.
still, it's that hands-on training that you people got. You
yeah,
were
but
lucky
I
to
always
have.
believed, Luciane, that if you had the knowledge, that it was a lot easier to put in the practical part.
Of course.
Yeah, so I always, and then of course we had to help do all the practical, clinical, work for and teaching, education for the nurses because they were all at Canberra Uni then. Yes. So when I worked in Queanbeyan, then I moved to the Walden Valley Hospital,
Yes.
brand new.
And you.
That was a good feeling because we were the pioneers then, in
of
the
course.
field. Yes.
Of course. And then from there, when did they open up the obstetrics? I can't say that properly.
It was about 74, because I was working, yeah.
So you went straight into that too?
No,
Did you
because
go
they
into that?
didn't have it then, but when they opened up obstetrics, the maternity ward at the Walden Valley Hospital, I didn't think I was going to go back having just finished my obstetrics myself.
Training and
Yes. But then the director, Mary Kello, she was the director, she said, Luisa, would you like to go up and we just open up the obstetric maternity ward? And I said, no, I didn't really want to go back to that. I just finished with the babies in Sydney. And she said, please, just for 6 months, till we get our staff established. So she said,
but you had all the training,
yeah,
too, and
fresh off the training.
Fresh off the training.
That's right. And in a big hospital like Paddington,
it
had
known
and had a very good reputation.
Oh, yes.
So she said she talked me into it. I said, all right, I'll go up there for 6 months, but then I'll come back when you've established your staff. But there I stayed, and I thought I might as well stay. Didn't sort of go back to. I never heard from her again, but she'd come up and she'd say, "So it's quite good."
Luisa that she might want to leave.
Yeah, so that was it. That was that one. And when I was at Walden Valley Hospital, they started doing the training at the post-graduation training at the. It was then, Canberra University was then the Advanced College.
Okay.
Yeah, Canberra Advanced College.
Yes.
Yeah, so I wanted to go out into the community. A lot of my friends have sort of moved into the community setting. And I thought, I'd like to do that because of the hours of work. And then because my children were getting a bit older and going to school, so that,
So the children came at what year? Because here we are bypassing the children.
Well, 72.
72 was Sydney.
Yes, Sydney.
And then how?
And then Langomehau at 76.
Oh, that's a nice gap.
Yes.
It's a nice gap.
So I had Sydney at the Canberra Hospital.
Okay.
The old, Royal Canberra Hospital. Yeah.
Oh.
Because that was the only one then, the one near the lake. Where we've got the...
Luisa, I do have a claim to fame with that hospital. I was the last patient to leave that hospital. So, and I remember coming out, and the press were there, and I'm in this not very nice dressing gown in my theatre gown, and there's, taking photographs of me because I was the last patient.
Yeah.
So that's my claim to fame. Not very anything to brag about, but...
Oh, it was a good hospital.
Yes, it was lovely. I like the lakeside.
And Luciana, when I was training at Leeton, and then we were all trying to work out where to go for our midwifery, obstetrics, and we applied for Canberra Hospital, but the matron who was there at the time, and all those ex-Canberra Hospital would remember, Canberra, she picked and chose who would, hand-pick the ones that would go and do their training. It was really hard to get in Canberra Hospital, yeah.
Goodness me.
So that's why, my second choice was Paddington.
Yes.
Yeah, the Royal Women's at Paddington, which was good.
Aren't you, as people say about Canberra, we're a little bit precious about all sorts of things, but we're lucky we live
That's right.
here, you know. And so you're in there, your children are born, happily living and going to school and doing all. So what?
My son was born at Walden Valley Hospital.
Oh, was he? There you go, Hal.
Yeah, Langomehau was born there, so in my hospital, so that was quite good, yeah.
Well, there you go. Happy birth at Walden Valley Hospital, Langomehau. And this is an invitation for you to come on and talk to us one day. I know he's a busy young man, but it'd be good to catch up with, with what your amazing children are up to. Yes. So with that, what else did you want to?
So, having done my, I went to Canberra advanced college and did the community health because I wanted to go out. Because in those days when we did our training at the hospital, all the postgrad, courses, you had to do them like separately, like go back and do,
Yes,
So I had to go back to, this time I went to the Canberra College, Advanced College, they called it then in those days, and did my community health nursing.
Okay.
Yeah, so that, and this time because I worked part-time because of looking after the children, because I was a mother.
A busy life.
Yes.
Working, mothering, studying.
Yeah, but also it was good because it gave you the practical part of it, a better understanding because you've been through it. Yeah, so it was quite.
So once you had another thing to your belt, under your belt, what did you do with that?
Then we still had to apply to come out and work in community health.
Community health,
Yeah.
right.
So we applied and went in, but the thing is, Canberra is small,
Yes.
so you practically knew the director out in the community, like you would have done. We would have done a course together, or something. Yeah. So we sort of went and interviewed for. No, I asked him. I asked the hospital because I was in obstetrics for all the maternity for that length of time. I was a bit worried because I thought I don't really know that much about medical nursing, surgical nursing, all that, and I wanted just to spread my wings a bit and get out of maternity with babies. Yeah, so I asked him. In those days, Chindali.
Yes.
Yeah, that was gerontology.
Up near Red Hill.
That's right. It's still there, but it's private now.
Oh, I see.
Yeah, so I said, to the matron, you did say to me that I'm only here, for 6 months, but I'm still here years later. So I'd like to do some medical nursing. And she said, I said, how about I go to Chindali? That's a nursing home. That was aged care.
Yes.
And she said, why? I said, I might be a good start, slow start. So she put me out there because it was part of the hospital, Warden Berry Hospital, but she put me out there like for evening supervisor there. Then my family said to me, you better get out of aged care nursing because all you talk about is old people.
Oh.
So then I decided I'll go out in the community. So
And that would have been when you left June.
This was 87.
Goodness, so you were there for quite a while.
Yeah, but about 3 years or 4.
Yes.
Yeah.
Yes. Oh. So out of Jindalee.
Out of Jindalee, out in the community nursing. And community nursing then, it was generalist, we did everything, all sorts of, and not just babies and, in the baby clinics and all that, but
home visits too, yes.
Home visits and all that.
Yeah.
So that was it. And then, of course, those people who, like me, who did the nurse training at the hospitals, we were sort of recommended, maybe it's a good idea if you do a degree conversion, because all the other nurses who were trained at the university came out with a degree.
Yes.
So they said, so that's what I did. And then Canberra Advanced College became University of Canberra.
Okay. Yes.
So a lot of my friends and I went back and did our degree conversion. You get a Bachelor of Science in nursing. Yeah.
In the new Canberra University.
Yeah, and that was
Which
near
was
too.
around what year?
I think I finished like 91.
Oh, goodness
Yeah.
me.
Because I did
Again, another,
part-time study sort of.
yes.
Yeah.
In the new Canberra Uni.
A new Canberra Uni sort of thing. It was really good, and like the nursing.
You're very good in places where there's a beginning.
Exactly.
Yes.
I think about it a lot, Luciana, and I thought That's why, people, when they complain about changes and everything, I love changes because I was
Yes.
getting used to it.
Yeah.
Yeah,
I think for us, it's about moving forward
that's right.
too,
Yeah,
or stepping up, or doing,
yeah.
Yes. Yeah. Because it is hard for some people to, just to be moved out of their comfort zone.
Mm.
I think people ask like a little bit of challenge now and again.
I think so. Oh, well, we do, don't we?
We do.
Don't we? We love the change.
Yeah,
Yeah, but
absolutely.
when I did my community health nursing, there were 3 streams there. You can either go teach with nursing, or you did gerontology, which is aged care, or child health.
Okay.
So I thought, smartly I thought, I know all about maternity and, babies.
Yes.
I think I will do aged care, gerontology. And that was the
Yes.
first time gerontology and those courses were done at uni, at the college.
Another new thing
That's
that happened.
right.
So
Yeah.
you did that.
We did that.
Two. To add to your whole list of...
But the thing
Things.
about it, talk about changes. We came out, and the political scene at the time, they decentralized all the thing, and they built all those health centers
Yes.
out in the suburbs.
Yes. Yes.
And then, of course, this other girl and I, one of my, mates or nursing friend, we did gerontology together. So we set up all the centers for the old people.
What a great thing. I really like the idea that there's, health centres all over the place.
Yeah.
That you didn't have to go all the way to hospital,
No, yeah,
But you
it
could
was
just
all
access.
out in the community. Yeah, so we set up a lot of the programs for the elderly people.
Aren't
We
we lucky
loved
to be
it.
talking to Luisa?
You
So
know,
you set up
we
all
set
those-
up all the aged care thing,
Oh,
and it was all in the communities, more health promotions. Yeah, so we did all that, and it wasn't just that, but we set up. Remember, in the political climate at the time, it was a Howard government,
Yes.
and it was about families.
Yes.
Yeah,
A lot of new
the families
things.
were supposed to be the cornerstone of the community,
Well,
and
of course
yeah,
it is. I'm
And-
glad they realised that then.
that's right.
And Mr. Howard realised that would have been an important thing to set up, because quite a lot of things were
And
set
I
up
think
then.
we, the law, started around in that era.
yes.
The climate, the political
Yes.
climate was just right.
Absolutely.
Yeah, and we did all that. So, yeah, we did all that, set
They thought
out.
that we were.
And also it's about, like, it was supposed to pull, remember it was just after they changed all the policies and stuff, from social policies to economic policies.
Yes.
So,
yes.
and then there's a lot of cut in our
Yes.
funding.
And also a lot of new
Yeah,
funding
that's right.
for new things to
yeah,
happen.
for new things, yeah.
Yes.
And
yes.
it was about, they encouraged you to work together with other, like, non-government agencies, work
the
together.
cross-cultural
Yeah,
stuff
exactly.
has happened, which, especially with community services, which community health was a part of, we were quite lucky because we got a lot of new training
Yes, we
into
did.
cross-cultural work.
And we set up, we were the, what do you call it when you're pioneers in those
Yes.
areas.
There you
Yeah.
go.
I look back and we did a lot of the training, but also,
And Louisa, because we're in Canberra,
oh,
you run the pilot programs. If it works, it goes out to the States.
that's right.
So you were piloting things for Australia. in a way.
And the thing is, I must admit, Luciane, working in Canberra, it was the environment. It gave you that enabling environment, and the money was
Yes,
there.
of
We
course.
were a bit spoiled then.
I
'Cause-
think it still happens, Louisa, because pardon me for barging in, but a niece of mine moved here from New Zealand, from Auckland, and she'd been headhunted, to come and work here, and she was shocked. She said the wages are 3 times more. So we don't actually realise, even in Australia, we are very well taken care of.
we are.
Yes.
And also living and working in Canberra, the house on the hill.
Oh,
You were
yes.
right there. You'd be going up the lift with the minister.
The boys
For
on
help.
the hill. Yes, you would be, and you do.
Yeah, that's right.
And you get used to that,
And he'd be
don't
saying,
you?
hello, what are you doing today?
Yes.
And then he'd be saying, oh, we're doing this. I said, oh, yeah. And then I'll give them my little tuppence worth, in the lift. And then I'll come out. And then,
But don't you think, Luisa, they're very approachable?
Exactly.
I think sometimes, I don't know what our ministers are like in Tonga, I'm sure they're the same. But here, you go in, and if you see them, or if you see them in the cafe,
That's right.
they're very happy to talk to you
Yeah.
and to see how you're going, and very happy to see what the people out there want.
Oh,
They've got an ear open all the time, don't they?
you know.
That's a clever politician.
Yeah, that's right. And we worked according to the
Yes.
political climate at the time.
We were absolutely
And
instructed by the climate. weren't we?
exactly. And also, it's sort of, I found like in Canberra, it encouraged us to get out there and be very innovative.
Yes.
Yeah, because I remember I had a little bit of trouble like when they changed all the policies, but I got a young brother who worked here, and he only just started working in a public service then. And then, Haleano. Yeah.
Yes, absolutely.
Then Haleano said to me, you know, the thing about this sort of, it's about collaborative, it's about, working and
Yes,
sharing.
partnerships.
Yeah, that's right. And he said it encourages the workers to be more innovative.
Of course.
And then you go out there and you set up all the programs in the community, and then you put it forward to them,
Yes.
to the department,
Yes.
and it's like,
And there was great trust.
exactly,
People
that's
like
what
ourselves in
I
the
was going to say,
community.
Luciana.
Yes.
Yes.
Because they're good in their jobs.
Yeah.
But they really had a good ear
That's
for
right.
people like us in the
Yes.
community.
And all
sector.
you had to do is put it in paper, you send
Yes.
it to them,
Yeah.
and you get a little smile and a well
That's
done.
right.
Yeah.
That's
Yeah.
right. Because we know what they can do, but they can't do what we do because we
No,
are
yes.
with the community, with the grassroots
Yes.
and stuff like that. But you're right, Luisa. There was great, not expectation. There was great encouragement.
Exactly, yes.
You know.
And they trusted as a employee.
Yes.
Yeah, and you had a voice
Yes.
in your work. Yeah.
Exactly.
Luciana, back then, before the changes were on, but I was quite lucky because I working with out in the community, because I came out to child, youth, and women's health, and I loved the youth. That
Yes.
was my thing, and because I went and had to go and do a little sexual and reproductive health course at the family planning. I did that.
Yes.
Because they started then to set up all the centers, and then they put in like youth centers. If you remember, we had the junction,
Yes.
not where it is now, but they had it where they've got that big, huge building just near Jolimont Centre.
Yes.
Near the
yes.
big health centre there. Yeah. So that
was it, wasn't it, for a youth centre? in
yeah,
Canberra?
it was a youth centre there. Yeah, and then I was starting to do all the sexual and reproductive health there. And then they realised that I think you better go and do all the practical thing, Luisa, get that little piece of paper. So,
Just to add to your pile.
so that's what I did. Yeah, and but I think this is a time when we all came in, because I was quite fortunate because there was a young Canadian youth nurse, who joined the Department of ACT Health then. That she came and worked because we ran the youth nursing from there as well. They worked in the schools, and did all those things. And we all went out to the schools.
Yes.
And
yes.
run a lot of the courses
Yes,
there, if you
yes,
remember,
yes,
Siane, because you were working one of the time. I was at the Narrabanda Health Centre. You were working with the women refuge there. Yeah,
Yes.
That's right.
That's why I met you, Luisa.
Yeah.
Narrabanda Shops.
That's right. Yeah. because it was all about that, all pooling the resources together, and it's what they encourage.
I must say though, Luisa, that when I first met you, before I could notice you, of course you can tell your face, but I didn't think you were Tongan when I first met you.
There's a lot of indigenous around
as
the
soon as
area.
as soon as you, because you don't, I mean, I'm so sorry, I shouldn't say that, but I thought either Samoan, Spanish, something like that. And then I realised when you spoke to me, I thought, of course it's...
Yes. Remember those, you and the Loa were starting then with the youth, yes. Which was just right start beginning.
Absolutely, because we're doing radio program, we see what, and then being introduced to doing the youth, and then meeting you, and I thought, oh my gosh, marriage made in heaven, you and I. Because I think that's, I've told Stuart this many times, that with you, it doesn't matter what I come up with, you're always very encouraging. And you never said, oh, don't be silly. No, because I do, sometimes my head is somewhere very different to where my head should be, but you always manage to bring it back to focus on whatever we're doing. Or
I think it's the area. I think it's Canberra that did that, because it was very a supportive, system to work with.
It's a nice little bubble to be in.
That's right.
Yes.
And it's like I say, it was in those days then that they encouraged us to you were encouraged to cross portfolios with the government.
That's right.
Public service. And remember, Canberra is all public service.
Yes. And we are public service.
That's right. Yeah.
But I think that's why we're lucky, because of that ability to do that. Also, the climate, the political climate allowed us.
Exactly, yes.
And gave us access to things that we may not have access anywhere else.
No.
Because, my family who come in from different states have always said, you are so lucky here. We have services and things that we can do that nowhere else in Australia can do. And we're lucky because we're right here.
Yeah.
The boys on the hill, as you said before.
Yeah, the boys on the hill. Yeah, because they encourage you to sort of work with interagencies outside.
Yes.
And also like Angli Care, GC Care, all those Barnados.
Yes.
Yeah, all those, private agencies, you were encouraged. And of course with Canberra Department of Health, we claim the fact that if it was anything to do with health, that our mission was to be the leading, service provider in those days. So that, and plus we had the resources, to do that, with being a government sort of service.
And I think, Luisa, as you said before, because of Canberra, and even with change of government, it was still possible to do different things, because each government bring whatever it is that's important for them.
Yes.
But it always seemed to, I think, because working here and having a working life in Canberra, you're taught to be, to meet challenges and to be innovative.
And
like
also,
you said,
it's about the community, Luciana.
Yes.
They demanded the best service. Yes. Yeah, I know.
But
we're here. We're not
because they know they'll
We are not Canberra bashing like how some people sort of.
Not at all. We love Canberra.
Yeah, that's right.
Yes.
Yeah.
And we've had the privilege of working here. Exactly. But I think, as I said, it makes you, it sort of really has fertile, brain growth anyway.
Yes.
And you're able to, and because of you can walk out to a cafe and you can meet people from all sorts of parts of Canberra and the government.
That's right.
We find that when we walk down to our little,
And remember when they used to say you can never do anything out of line in Canberra because everybody will know, because it's such a very the community.
Right.
Yeah.
Someone said to me, "There's a series, I can't remember, Secret City, I think it's called," and someone said when he was watching it, so you better be careful. You're sitting in a cafe, you might be sitting with a Japanese spy or a Russian spy. I said, who knows? Eh? It makes it all the more exciting to be in Canberra.
Yeah. Yeah, we did. We ran. I remember, in Griffith, that suburb, there's a lot
Yes.
of
Near Manukau.
accommodations there for
Yes.
aged care. So when we came up, my friends and I, we used to run exercise groups out there. Oh, that was good fun because all the ladies but it was because we were allowed to do those
Yes.
things. And then as
And
long
you were
as
only
you
allowed,
reported,
Luisa, because you were trusted.
yes.
You had all the training background anyway, so there's not as though you're going to run the poor old ladies up the hill, Red Hill.
No, it was just nice being in touch. And in those days, remember, it was about sharing the power with your clients. Yeah, because they had a very strong client advocacy, or
Yes.
what do they call the advocacy thing?
Yes.
And you only had to say the wrong thing, Luciana, and the next thing they ring up. That they had access.
Yes.
People up in
They
the hill.
could.
Yeah.
And it's a very good thing, Luisa.
Yes.
But also it made us all the more careful of, and sometimes it still depended on, things could happen because mistakes happen.
That's right.
Everywhere. And sometimes
they
it's
were
not a
aware.
worker mistake, but it could be just a misunderstanding.
And they're aware of their rights.
Oh, they're very aware.
That's right. It was
Yes.
about sharing that power with them.
Yes.
And you had to do it because you only had to say the wrong word. And it gets to the minister's office,
Oh, yes.
then it comes,
Yes.
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 I
You are
remember,
being called.
yeah, I remember one, and that was the only time because I never forgot that, and that made me learn my lesson. I went into the clinic, I won't say because of Canberra being a small place, and the receptionist at the front desk, and I said, good morning, is there anybody around the clinic? She said, can I speak to you, Luisa? And I said, yeah. And she said, there's a lady waiting there, but she doesn't want to see you. And I said, I got a shock. I said, I beg your pardon? And she said,
Who would not want to see you?
well, but it's a wake-up call,
Exactly,
because you get
yes.
too relaxed and,
Yes,
too overconfident sometimes, Luciana, which could happen. And she said she didn't want to particularly ask if she doesn't see you. I said, did she say why? And she said, yes, she said, because you don't listen. And I thought, that was a wake-up call, isn't it? So I said, all right, I'll go around and see her. So I went round to the waiting room, and I said, good morning. She said, good morning. And then I said, look, I'm sorry. The receptionist told me, that you don't want to see me. I said, but that's fine. I said, I'm really sorry if I didn't listen to you. I said, yeah, sometimes you don't think, stop and don't think. And she said, yeah. I said, oh, really sorry. But I said, if you wait here, my colleague who's going to open the other clinic, I said, she's a lovely lady. She'll see you, and I'm sure you'll be happy.
Listen to you.
And she looked a little bit nervous, and I said, don't worry, I'm really, I apologize for not listening. Because sometimes it's about that power thing, Luciana.
Yes.
Because when you're too overconfident with your knowledge and stuff, you can be patronizing, without realizing, And I think a lot of times with my cultural background, how you really have that caring thing, and then you talk to them. Whereas a lot of these young Australian young women, they see that as patronizing.
Yes.
And you never think about that, because you think that you are the thing and you are older and but that was a good lesson for me because I never did it again.
And I think we as workers, because working in the field with people, as
That's
clients,
right.
with you just, and sometimes it's not just something that you did. It's just something like, if, for instance, if I'm unwell, nothing that Siwa says is right. everything he says doesn't sit right because I'm not happy and I'm unwell. And I think sometimes it's a little bit like that. And if we just, when we remember, because I know my boss, my manager was very good at that, and she'd say, don't forget you're working with people that are unwell, that are fragile. And sometimes when you go bouncing in there, it's a bit too much.
Yeah. Well, that's it. And the thing is, with these young parents, they're trying to do the right thing.
Yes.
And if you're sort of saying to them, oh, yeah, this is how you do it, that instead, well, the next thing I did, that was a good learning thing for me. Then I decided I needed to go back to uni. Yeah, so I went back to ANU, the Australian National University. Yeah,
yes.
I went and did women's studies.
Yes, you did.
Yeah, because I thought that was a good challenge.
Because one of your supervisors may have been my boss, because she was supervising and teaching in that course.
Oh,
Winsome Willow.
Oh, yes. Yeah.
But you see, Luisa, someone who may have gotten that reaction from a client may have become really resentful and said, well, too bad. But you took it a totally different way.
I welcome her feedback because I knew. Sometimes when you think you're so full of knowledge, you know, but it's about undermining those young ones. Yeah, and my own children tell me that. Yeah.
Let's not start with our children, our wonderful, loved children. Yes.
Yeah, so that made me...
They really show you the truth sometimes.
So I went to... I applied then, went back to studying at the National University of Canberra.
A really good course.
But that was a bit of a shock, having done Canberra Uni, you know, and all that. But
ANU is a little bit different.
It's a little bit like watching those British movies, like schools in UK.
Yes.
Yeah, but I did women's studies, and it was really good because it was about women, and it was about critiquing things, it's about understanding, you know, a lot more. And that was good. That was the best thing I did with my nursing career because it made me look from the other side. Yeah, so it was good then.
Because we had to do that. And there were only certain people in women's services that they had to do that. It was just a prerequisite. But it was good because our wonderful Winsome Willow was in there.
Yeah.
So
but that was a bit of a challenge because when you are a very mature student and having done all those other courses, I thought, well, I know it, and then I know my community. And remember, in those days, we were doing all the NGOs, like you know, sort of thing.
Yes.
Yeah, and the schools, we went out to the schools as well.
Yes.
Yeah,
and there were so many agencies.
Yes, that's right.
Run by different, you know,
so
like
it was a
Richmond Foundation.
It was a change, another change.
Women's services, lots of changes.
Because I remember, because I thought I was so full of knowledge that when even as a mature student, that one day, the lady, the lecturer, you know, she was a young PhD graduate sort of thing, and she's written a lot of books now that I got to know her. And then she said to us one day, you know, maybe you come from the, you know, workforces out there, but when
I might know who you're talking about.
She said, but when you're here, you're still a student, you know. But then I thought, well, we are mature students. We don't have to be. Because, Luciane, sometimes I look back, I always miss my dad. Because I thought, Dad, you're the only one who know me.
Yes.
Yeah, that you see that it's just me. It's not me trying to be smart.
It's just
you.
Yeah,
that's right.
Which is how you survived with all these credentials all these years.
And all these brothers I got too.
And all your brothers.
Yeah, there was sort of 8 brothers. But so that was the best thing I ever did was, I'm not sure about my husband, where I thought that was a good thing going back to uni studying again. Yeah, But so that was a graduate
It's
diploma.
a bit getting used to for families.
Yes.
Yes. But you managed it.
I did. And also, like, the lecturers, like, were about, I think I was older than some of
Yes,
them.
I think so.
And then they used to try and say, from nursing, all the theoretical stuff, and then practical. But then with women's studies, they had trouble with me because she said, Luisa, can you just sort of leave all that,
Yes, put it to the side.
put it aside. Just think, just that took me a lot of,
Yes.
that was a challenge for me,
Yeah, it
Luciana.
would be.
Forget about the solid things. It's all about waffly stuff.
This is
yeah,
different.
that was it.
We're just staring at navels at the moment.
Yeah, that's right. Yeah. So when I came out, that really helped. With having to deal with people out in the community. And remember, Canberra is always used to the best service.
Yes.
Yeah.
Yes. And we advertise and let people know that.
Yes.
And it should be. This is a capital city, but so this is where all the things flow.
That's what I used to think.
It flows, not just like Lake Burleigh, but it flows out to the other states.
Then when I was working with the youth, I still did the child health, clinics and new parenting groups and stuff. But the youth was my challenge, because I did sexual reproductive health for them, and then also it was drug and alcohol.
Yes.
Yeah,
Luisa.
mental health. But
Gosh.
it was in an environment where you only had to pick up the phone and ring somebody in drug and alcohol.
Yes.
Would you like to come? Could you give us a talk?
And
they'll
like
come.
that.
Yeah.
Yes. And we really utilise that with our Pacific
Yes,
Island Youth Network.
that's right.
Oh, gosh, yes, Luisa. And that's, sometimes I do, when we talk to other communities and stuff, we say, you just got to pick up the phone and ring them.
That's right.
And they're happy to talk to you.
Yeah, exactly. And then I was into my women's stuff then when I came out from ANU, from the National University, because it was about women's studies. And remember in those days, it was about CEDAW, it was about...
Yes.
all those
Full
things.
on.
Yeah, full on. And at the time, I took on Pan Pacific.
Yes.
And Southeast Asian women.
You did.
Because I grew up in Tonga.
Because you had 2 minutes
Yeah.
left in your...
That's right. Pan Pacific, yeah.
Yes. So Pan Pacific then, can I ask you what year that was, Luisa, you started Pan Pacific?
I must have been it was on to near the, in the 20s as well.
Oh, yes.
Yeah. But well before that I started,
Yes.
but not when I came out of
You became
ANU.
president of Pan Pacific
in
2000 something.
Yeah, and also like international thing, Australian thing, because I was we had the head of the Pan Pacific president.
Yes.
Yeah, the national president was from Sydney.
Okay.
Then I was
You were the Canberra.
Yeah,
Yes.
the Canberra sort of
Yes.
vice president.
Yes.
Yeah. Well, and then we had a conference in Bali. I gave a paper.
I remember, Luisa.
I gave a paper on the
Yes.
social inclusion. Remember,
Oh,
that was a
I
thing at the
remember,
time
yes, I
in
remember
Australia.
the time. Oh,
Yeah.
you're bringing up quite lovely memories, Luisa.
I think Pan Pacific kept me in touch with the Pacific, but I
Yes.
just want to go on back to. I think the highlight of my community health nursing or child, youth, and women's nursing, or my whole nursing career, was the teenage parents, because it was becoming a big thing.
Yes.
There's so many like young teenage parents, and with the globally, it was
Yes, it
becoming
is a problem.
a problem.
And I think it still is in a lot of places.
Yes.
I know I watched something about Auckland with that. It's becoming more, not less.
Yeah.
So,
But it was
Yes.
to do with the preventing poverty
yes.
and stuff, and sort of spoiling their little pathway with their education.
Yes.
And once again, Luciane, just Canberra. Yeah. It just took one young girl who sort of cried out for help. And then with this other youth, I had a Canadian youth nurse. She just came. She did a lot of work internationally.
Okay.
So she said, how about we do this? And I said, yeah, let's do it. So I was the maternal child health, all that part, parenting. She was the youth, because as you know, the youth section is very challenging.
Yes. Oh, we know that, don't we, Luisa? Yes.
We set up
wonderful challenges.
We set up this program that was called, what do we call? Oh, the Positive Parenting for Young Parents. Yeah. We set it up centrally in the city. Yeah, but we took it out to Walden.
Okay.
And then we ran the program.
So you ran it from there too?
Yeah, and we went around. And do you know how many we had at the time, in that era, we had 12 parenting groups for the young parents.
Really?
Yes.
Is it from the different, health centres and...
Different health centres, but we coordinated. We hooked up with antenatal care.
Oh, right.
From both hospitals.
Yes.
They joined in because we built up an interagency, thing. And then we had Canberra Hospital. We set up a special clinic for those young mums at the Canberra Hospital, and they had a nurse specifically for them, for their antenatal.
Yes.
Yeah, and it's like postnatal, we filled in that part as well. And that ran on for a long time. And also, one of the schools, Canberra College.
Yes, in Balconnen.
They took on the partnership. And
is that Balconnen, am I right?
No, the one in not Walden, past Walden, but
yes,
around there.
Around
yeah,
there.
That's right.
Yes, that's Canberra College, of course.
Yeah, that school set up a special program, and those young people could go to school and continue to study.
That's right.
Yeah.
You're so right, because you have spoken about this before.
That's right.
Amazing programs like that brought people back.
Yeah.
They didn't feel like that they were just ostracised by society.
No, but they were in. That's right, yeah.
And there were quite successful young people that went through that.
And then they ended up running it themselves.
Yes.
We were there just to support. I was always very proud of that. And also, if you remember the junction, in the city, all those marginalised kids who dropped out from school.
Yes.
Yeah, we opened up a clinic in there just to give them the access, because it's what they encouraged at the time, to make sure that those clinics and things were accessible to the young ones. Yes.
Exactly, because there's always the conversations that are had, that if you don't do it, and if you don't, it's like you shouldn't be encouraging. It's not encouraging people to do that.
It's about education.
It's all about that. And just because you're uncomfortable about talking about a certain issue doesn't make it go away.
Especially like with some Pacific Islanders.
Yes.
But I could understand it was hard because some of the kids were still at school.
Quite difficult.
But also it was about reproductive health.
Yes.
We ran those to help the young ones.
And in programs like yours were assisting young people to take responsibility.
Yeah. And also to continue with, one day I came back from, we drove back from Sydney. This was after I retired, Luciane, and this young lady came up. She said, "Excuse me, aren't you my name?" And I said, "Yes." She said, she was a lawyer now. She done her lawyer. Yes. And then some young ones have come after me in the other clinic, And they've really continued with their life.
Absolutely.
Yeah.
And not even that she was a lawyer. It's just someone who takes control of their lives and able to manage it. That is, at the end of the day, that's all you want, is that people not be lost, to have some control of their lives and to carry on.
Yes.
And being a lawyer, oh, how amazing. Even if she ended up being in another relationship and that being successful. And Luisa, that's that time again.
Yes, that time.
The end of time again.
I think, but that's what I wanted. I just wanted to wrap up. So with all the things I've done, and especially my professional journey, I think that was the thing that I took away with me, because I remember those young ones. It is about just giving them the opportunity to pick up their life again, get off drugs, and get on with, and went back to uni. One was just finishing her nursing career, but they remembered
Wonderful
me.
stuff.
Yeah,
Yes.
sort of.
And they will always remember you,
Yes.
Luisa, because you do. And you and I, you always remember people who were important in directing your lives and giving you opportunity. All that, you never forget them, do you?
So I retired now for almost 5 years.
Lady of
That's
leisure.
right. Yeah, but I enjoyed. But I keep thinking back and
But you're not quite already retired. I was talking in the program with you and I said, we don't retire here. You just find something else to do. And, the Our Women's Network, which I'm a part of, those women came from public service and they found other things to be busy with. Unpaid but really fulfilling. And that's where you are.
I think I am the grandmother. Yeah, but like I say, this clothing, I think it was my growing up in Tonga and in
Your
my life.
environment, home environment.
That's right.
It was just fertile ground for you to sprout
That's right.
and grow.
I
And
just
you
needed
had
the
a very
money and the
unique-
support, like to
No,
do.
Luisa, but when you spoke, you had a very unique start of life, and
I think it's
you
blessed.
don't realize until later on you think, gosh, it was different.
Yes.
Not many people are lucky enough to grow up in the grounds of a school, and just that being your background, your environment, your area of knowing and people that you knew and grew up with. But this is what, we always say, well, that's why you are the person that you are today.
Oh, thank you, Janet.
Because of that.
You two have been, I think, beside my husband, Latukefu, there, sitting there sort of listening, pretending he's not
He is the
listening.
great, what
Yeah.
I've heard you saying, Votuliki, or the
The
main
cornerstone,
post,
yes.
the main corner
The
post,
foundation,
that
like-
you lean on, Luisa.
Yes.
Yes.
Yeah, he's there. And then also like with Professor Laftani, he's been that little building bridge all the time between our children and our culture.
The little person that we like to kick when we're not happy.
That's right.
And
yes.
he kicks back too. But
it's
yes.
yeah, because Lyle sort of picked up at the
Yes.
time.
So you're going to be busy again.
Yes.
Because I think I'll just take this opportunity, Luisa, to welcome you back, and that Luisa is going to be starting a new program with our media, and it's going to be Women in Dialogue. And remember your program, Women in Dialogue. Women in Dialogue in the city of Canberra. But this is a program that Luisa and I helped her with it in the CMS radio.
Yes.
And that was very popular.
And we forgot to acknowledge our queen in Tonga. Wasn't she back? She helped with a lot of our
She gave us
program, the name
yes,
for
she
our
gave us the name for our first program, Potatala Ai Kolomoa Dialogue
That's right,
in the capital. Queen Nana Spa'u, thank
It's
you
very
much, Your
supportive,
Royal Highness.
with
Yes,
those,
yes.
encourage.
And she keeps a close eye on what we do here.
Yes.
She's quite, and our ambassador here. Our ambassador here, of course, is the Princess Latukefu, and she keeps a close eye on our community and what people are up to.
She's with it.
So we are very honoured to have her here. But Luisa, you're going to be back in a fortnight's time to do Women in Dialogue, and that will be talking to specific people, women especially, in Canberra or wherever you find your women from, to see what they're up to, just like what we're doing today.
I do hope Professor Laftani and Luciane Twitter Laftani that so why do we do this? It's about hoping to empower a lot of young women out there. That it's out there. It's about
Absolutely.
encouraging them
Yes.
find their way. Yes,
And you will find your way.
Yes.
You will find your way. You just got to look and you know, just get into doing something. Because it's
That's right.
amazing. You just think, oh, I wonder if I could do that. Just go and do it. You'll be nicely surprised
Yes,
what
that's right.
what you're able to do.
Yeah, come and do it in Canberra. That's the
Absolutely.
place to do it.
It is the place to do it, and you'll be assisted and supported and paid well
Yeah,
to do it.
and mind you, I've never worked anywhere else but like Canberra,
Yes.
so I always think it's the best.
Thank
Good
you
luck
very
to all
much.
the young women out there.
Absolutely.
Yes, it's
Absolutely.
about empowerment.
Thank you so much, Luisa Latukefu, for joining us in this. This is like Women in Dialogue anyway.
Yeah.
We're talking about your life, your amazing life. And the continuing of your amazing life will be Women in Dialogue. Thank you so much for
Thank you,
listening.
Luciana. Thank you to our technician,
Yes.
Professor Latukefu. I nearly said, sorry, I beg your
See,
pardon.
See, you can't get your wonderful husband out of
Of
your
my head, yeah.
Yes.
Laftani, Professor
Latukefu, who
Laftani.
has always been there to support us every step of the way. Mahalo, thank you so much for listening.
Ofatu, yes.
Ofatu, Opito.